to the ISU online basic EKG interpretation course. I'm excited you're using this avenue to learn one of my favorite topics. I hope you enjoy the class. This presentation introduces you to the class, so let's get started. I like to include my professional background in presentations like these, so you're not saying, and how is she qualified to teach me? But I'll keep it brief. My name is Cheryl Hartog. I entered healthcare at 19 as a nursing assistant at Pocatello Regional Medical Center. I was a CNA for 6 years as I finished my RN degree, then gave them another 5 years as an RN. During those 5 years of RN practice at the bedside, I had the opportunity to work all shifts and in all areas except for those for moms and babies. Pocatello Regional didn't have OB/GYN services. I even had the opportunity to do medical transports, but my favorites were those that stayed busy, like the ICU, ER, and medical surgical units. In 1998, I was approached by an LPN instructor when a position opened in that program. While there, I taught every course except mental health and OB/GYN, and taught in all settings and via all mediums: classroom, lab, clinical, online, distance TV, etc. Workload while going to graduate school for my degree in nursing education and never seeing my family motivated me to move over to workforce training in 2006. There, I manage over 20 programs like EMT, phlebotomy, dental assisting, CNA, and the like. In the middle of all that, I also spent a year as adjunct faculty in the 4-year RN program, but had to turn down a permanent job as I love the job I have, and it works better when you have kids and can't be available as much as they need me to be. Anyway, now that you know me, let's get started on the learning. When I was an RN at the hospital, about 4 years in, I took my first EKG class. I learned about it in nursing school, but that was an introduction, not very in-depth. I remembered little of what I learned, and we didn't go very in-depth on the topics because at that time, only doctors were really accountable to understand the information. Anyway, the course I took was over 1 day, a 5-hour course where I had to take a test the last 30 minutes of the class. And I got the book at the start of the class. Not the best learning. Then I was expected to remember what I'd learned so I could add on another entire textbook for an advanced cardiac life support class a week later. Now, thanks to some ICU nurses who took me under their wing and helped me learn a few ways to memorize the information quickly, I passed both classes, but it's not the best method of teaching or learning a topic. It can be really somewhat confusing and difficult to remember. I'm hopeful this will be a much less stressful experience for you. Let's talk for a minute about the title EKG. Electrocardiogram has a C in the middle of it, not a K. Electrocardiogram was derived from the German version, which does have a K. However, the inventor of the EKG machine was Dutch. That's William Einthoven in the image there. Without delving too deeply into the history, I'll be very frank and say I don't know why we use the German abbreviation. I just know that we do. This course is an introduction or refresher EKG interpretation course. There are courses for those who have jobs requiring more advanced knowledge. I'll talk about the populations this class serves in just a minute. While I took a 5-hour course, this one is intended to be about 12 to 15 hours. You may require more or less. Each student varies in the speed they'll learn the class concepts. Some will grasp it right away, especially if they've learned about it in another type of training program or if it's a refresher course. That is, they've taken the course at some time in the past but might have forgotten some or all of the concepts. Others may have to return to previous learning material to remind themselves of certain things before continuing. That's why it's nice that it's a web course that allows that. You'll each have plenty of time to complete the course around your own schedules. A vast population of students take an Introduction to EKG Interpretation course. There are those who have taken short-term health training programs, who are taking it to make themselves more marketable to future employers, or because they have added duties in their current role related to EKG monitoring. I give the examples of CNAs, technicians such as monitor techs at a hospital, or orderlies. We might also have health program students who learn the material in their training program that either want to learn more or it was crammed into too short of a time period, and are licensed or certified medical professionals. Examples I give are EKG technicians, emergency medical services workers like EMTs, paramedics, nurses, physician's assistants, medical assistants, doctors. I could go on and on. If you don't use this information regularly, you lose it. But it does tend to come back pretty quickly, at least if you learned it well to begin with. The point is, this course is intended to serve that vast population. I need to teach those who haven't learned this stuff before. I'll define terms as we go, stress difficult points, and other things to assure you all understand. And I have to stress that you may learn things in this class that are outside your job description. You are accountable to check your job description, and if you learn something here outside that scope of practice, you're accountable not to do those things. For example, to add to your understanding, I'll provide information on what a doctor might do for certain arrhythmias or irregular heartbeats. You can't then go complete tasks only a doctor have a scope of practice to complete. I think you understand. So let's move on. I also like to give some alerts. I'll present information in an exact order. You'll need to thoroughly understand previous concepts to understand later concepts. I encourage you to pay close attention to the presentation and the handouts. You don't want to rush through assignments. Spend plenty of time. As information is added, it will be more difficult to distinguish different arrhythmias. You want past information firmly in your head before adding new information. I'll help you by giving you plenty of resources and practice opportunities. Some will want to utilize all I provide. Others won't need everything. Now, this isn't a workshop type class, but a health program, so there will be competency testing. You need to achieve a minimum on the course final exam to receive a certificate of completion. Think about it, your patients rely on this to keep them safe. As a standard in this type of class, we also want that competency above the usual percent to pass, so we keep it at 80%. And while you'll be given a generous amount of time to complete the class, you won't have a never-ending deadline. The final exam will be posted when you alert me. A note on that final exam, it will be open for a narrow time window, so you want to learn the information to the level you don't have to look things up for that exam. Think about it, this content is related to life and death, and we don't have time to look things up out there in the real world. Now, I always get 2 questions in the course. Can I retake the final exam if I don't get 80%? With this being a low-cost class, I would require you to take the class again to retake the final. But I'm as generous as I can be when grading it. Most students do just fine. I also get requests for a certificate of attendance if the student doesn't pass. To give that suggests that person passed the class, so I can't give out a certificate unless you do pass the class. In any introduction presentation, I'd like to do a quick review of what will be covered over the course. In Part 2, we'll do a very basic overview of cardiac structure and function, and cardiac conduction, what that EKG is measuring. Next will be lead placement, or methods to place the device necessary to perform an EKG. Those are called leads. And I'll distinguish EKG from another way to monitor cardiac conduction, the cardiac monitor, which we call telemetry. In Part 3, we'll move into the basics of rhythm interpretation. First, we'll talk about how the EKG works. That helps you understand the next step, how to analyze a rhythm strip. Now, there are a few steps to that process, and we need to consider all the steps, because missing one leads to incorrect interpretation. In Part 4, we'll talk about sinus rhythms. The rhythms we'll see in a normal, healthy heart, plus a few slight variations, before moving into abnormal heart rhythms called arrhythmias. The remainder of the presentations will cover arrhythmias in 3 categories based on location of the heart: atrial arrhythmias, atrioventricular junctional arrhythmias, shortened to junctional rhythms so it's not such a mouthful, and ventricular arrhythmias. I'll also include a few that don't fit into any one of these categories or that cross more than one category. Finally, throughout learning the arrhythmias, you'll be given a lot of practice interpreting strips. In fact, most of your final exam will require you to interpret rhythms with no more information than a rhythm strip. In conclusion, I do want to stress what we won't be covering in this course. While I might touch on symptoms and treatment of arrhythmias to help you understand the effect that can occur in a person and extreme measures that might be necessary to save a life, I won't go into an extensive list of symptoms and treatment. That's because it requires more than a basic understanding of structure and function of the body, which would require a much longer course and state or national certification to practice. but I will give you some resources to learn more if you need that information. Now that we know what we will and won't cover, you're ready to begin the learning. See you in part 2.